The role of agriculture in SAN. What is SAN? SAN is scaling up of evidence-based interventions. And this is in order to help those, in order to help those countries which are at risk of undernutrition, for them to meet the Millennium Development Goals. We have the SAN strategies. They are in 3 groups: behavior change interventions, micronutrient and deworming, and complementary feeding and therapeutic feeding. I'm focusing on the behavior change interventions, where we have exclusive breastfeeding, complementary feeding, and improved hygiene. That's where most of our efforts in the agriculture are. These above interventions are the interventions that have shown impact in preventing malnutrition, especially stunting and undernutrition, excluding my own stunting. We are focusing on the pregnancy and up to 2 years. This is a critical period for optimal physical growth, mental and intellectual capacity. The SAN is based on collective actions, evidenced good practices, as well as on the specific needs and capacities of countries. So what we want is to make use of those interventions that will bring high economic returns, as well as making sure that we are using multi-sector approach. The role of agriculture in SAN. Our role is within the 3 broad areas for action under SAN: food and nutrition security for all. We have the food and nutrition security policy. Nutrition-focused development. This is one of the main issues that we are supposed to agree on at the end of this gathering. And the third component, nutrition-specific interventions. My boss has already indicated that we are talking ASWAP. We have our nutrition components included in the ASWAP. The role of agriculture in SAN. As agriculture, we are going to make deliberate effort in responding to nutritional needs of all gender categories. Some of the efforts have already been mentioned this morning as part of the research. Our role is to emphasize on the prevention based on sustainable strategies for improving dietary quality, concentrating on the 1,000 days. Not just that, but beyond that. We are also going to prevent stunting in Malawi by investing in nutrition-sensitive agriculture. What we are saying is that nutrition should be integral in agriculture policy, as well as an intended outcome with measurable indicators. And we are going to do this by applying the value chain approach. The value chain approach was already demonstrated yesterday through the knowledge fair. Here is the table of proposed scope of interventions needed. Under the policy, we are going to incorporate areas that are multi-sector. The issue being addressed is that food alone is not adequate to achieve optimal nutrition. We need integrated programs. Research, a lot has already been said. Under research, we are going to focus on the prevention of micronutrient deficiency. And production and access. This should not be limited to crops only. There is evidence that animal food sources promote growth. Therefore, this has a direct relevance on the stunting. Post-harvest handling, we want to ensure food safety as well as sustainability of food supplies. We are also addressing issues of technologies that are aimed at retaining nutrients as well as improving nutrient availability. Food utilization, dietary diversification for all gender categories, availability of nutritious complementary foods, focusing on the 1,000 days pregnancy to 2 years. Finally, in conclusion, policy should focus on enhancing complementarities and synergies through a holistic multi-sector collaboration, and we are also supposed to use participatory approaches using cost-effective interventions for continuity. Agriculture and nutrition and health have to work together, including other sectors, public-private partnerships. This is key in advancing the SUN agenda. Thank you.